This is my mom. She doesn't see very well. In fact, she's legally blind and has no depth perception. She often has trouble moving around and is in constant pain. She has multiple health problems, the most prominent being multiple sclerosis. Multiple sclerosis, or MS, is an autoimmune disease of the central nervous system that disrupts the flow of information within the brain and between the brain and the body. MS causes issues with my mother's cognitive function and often leads to pain, muscle spasms, and seizures. Luckily, there's a medication that treats almost all of her symptoms and has completely changed her life. The problem is, this medication is extremely controversial and is not available in all 50 states. This medication is marijuana, and there's an overwhelming amount of evidence to suggest that it has not only benefited her, but saved her life. Medical marijuana is currently legal in 29 of the 50 states and can be used to treat patients with a variety of medical issues, such as cancer, AIDS, Parkinson's, schizophrenia, and of course, multiple sclerosis. The medicinal uses of marijuana come from the cannabinoids and compounds. These cannabinoids and compounds are found within marijuana's chemical makeup. In marijuana, there are over 140 active cannabinoids and around 400 other compounds that have medicinal qualities. Cannabinoids mimic the actions of signaling chemicals in the brain called endocannabinoids, which dock with specific receptors on the surface of cells. Each cannabinoid acts on different receptors in different ways. For example, the cannabinoid THCV combats inflammation in the body and protects against liver damage. It also changes how the serotonin receptor behaves during psychosis, making it a treatment for mental illnesses such as schizophrenia. Another cannabinoid, CBG, affects the adrenaline and serotonin receptors and is an extremely effective pain reliever. The other possible uses of cannabinoids include treating stroke, PTSD, epilepsy, and even drug addiction itself. Marijuana also contains compounds such as terpenes, limonene, and flavonoids. These compounds also have medicinal uses, and research has found that many have anti-inflammatory, anti-seizure, and pain-killing effects. These cannabinoids and compounds are what give marijuana its medicinal effect. Marijuana is classified by strains, and each strain can be bred to treat specific medical issues. Strains can be created and altered to contain more of or maximize the effects of certain cannabinoids and compounds. For example, the strain often given to patients undergoing chemotherapy was created by crossbreeding existing strains that contain high levels of CBD, a cannabinoid that decreases nausea, and THC, a cannabinoid that stimulates your appetite. This strain treats the nausea and appetite loss experienced by those that undergo chemotherapy. Some of the symptoms my mother commonly experiences are seizures, difficulty walking, severe pain, and issues with her muscles such as spasms and tremors. The strains of medical marijuana that she uses combines anti-seizure compounds, pain-relieving cannabinoids, muscle-relaxing cannabinoids, and other chemicals with medicinal purposes. There are downsides to the use of medical marijuana, as there are for all medications. First, smoking marijuana is bad for your lungs. Inhaling smoke is always unhealthy, which is why most patients that use medical marijuana seek alternative methods of consumption. Many patients use marijuana oils, creams, and edibles to avoid the dangers of smoke inhalation. Marijuana is also not suggested for use during pregnancy. Other than this, there is very little evidence that suggests marijuana has negative long-term effects. In fact, marijuana is much safer than many alternative medications that treat the same symptoms. One prominent example of this is opioids, which are often prescribed as painkillers. Opioids such as oxycodone and hydrocodone are incredibly addictive and oftentimes lead addicted patients to use heroin, a cheaper and more dangerous street opioid. The overprescription of opioids has created an opioid crisis that claims tens of thousands of lives every year in America. A safer alternative to opioids to treat pain is medical marijuana, on which an overdose death has never been reported. Marijuana could be the answer to the opioid crisis, but bias and controversy has made its legalization incredibly difficult. To better understand legalization efforts, we must go back to when and why marijuana became illegal in the first place. For most of history, marijuana was used as medicine. Anglo-Americans and Europeans have known about marijuana's medicinal benefits since at least the 1830s. Around this time, Sir William Brooke O'Shaughnessy, an Irish doctor studying in India, documented that cannabis extracts could ease cholera symptoms like stomach pain and vomiting. By the late 19th century, Americans and Europeans could buy cannabis extracts in pharmacies and doctors' offices to help with stomach aches, migraines, inflammation, insomnia, and other ailments. However, at the turn of the century, American attitudes towards marijuana shifted due to Mexican immigration to the U.S. This immigration was met with the typical xenophobia, which extended to the Mexicans' traditional form of intoxication, smoking marijuana. The government and police spread lies about the drug, saying that it caused a lust for blood, superhuman strength, and incited violent crimes. False stories were shared about Mexicans giving quote-unquote killer weed to unsuspecting schoolchildren, which resulted in death and destruction, and crimes across America were blamed on marijuana. Americans were terrified of immigrants and of this drug. This led to the criminalization of marijuana across the country. Most experts on the topic believed that these lies and laws were racially based in an attempt to imprison more Mexican immigrants. Even today, the numbers on marijuana arrests show us that disproportionate numbers of minorities are imprisoned for marijuana-related offenses, when it's been proven that all races use the drug equally. It was only when these laws began affecting upper-class white college students that legalization was proposed. Marijuana became illegal because of lies and racism, not because it posed any threat to American society. All of this information has informed my opinion on medical marijuana. Now, obviously, this issue is incredibly personal to me and has truly changed my life. This is why I fully support the legalization of medical marijuana in all 50 states. When prominent figures such as Attorney General Jeff Sessions say things like, all people who smoke marijuana are bad people, I believe that they have a warped view of the uses for this drug. This narrative is the result of racism, lies, and partisan value prioritization. When the conversation is science versus bias, science should always win. Medical marijuana is on the side of science. As someone who's dealt with this issue firsthand, I know the positive effects of medical marijuana and see them every day. I'm in no way advocating for the illegal recreational use of marijuana, that's a whole different issue, but rather for the expanded medical use of this safe and useful drug. Without marijuana, my mom could easily be addicted to painkillers, in more pain than she's in right now, and generally have a lower quality of life. Marijuana is controversial, but that doesn't mean we, the future of America, should be deprived of the facts on it. The fact is, medical marijuana is incredibly beneficial and is an effective medicine for multitudes of conditions. Recently, we've forgotten that science and fact are unchangeable and nonpartisan. This is why it's important for you, a young American, to know the reality of medical marijuana. If you don't want to believe me, take it from my mother.
Okay, so this is my mom, Nell. Hi. So you have used medical marijuana, and you use medical marijuana, correct?
Correct.
And what do you think have been the benefits of using medical marijuana for you?
For me, it's been very helpful for the pain, and I have a lot of joint pain, and also it's been very helpful for I get very worked up sometimes.
And do you think there have been any negative effects of using medical marijuana for you?
For me, physically, no, I do not. I feel lucky that I have that option, that I don't have to take painkillers and opiates, and
And what did you think of marijuana? Like, what were your opinions before you started using medical marijuana?
I wasn't against it, but I wasn't a big, I had tried it a few times in college, yeah. But I wasn't really a big, but I definitely had hung out with,
And what would you say to someone, such as some of the recent politicians have been saying, anybody who uses marijuana is a bad person? What would you say to those people?
It's absolutely ridiculous. I mean, when you look at all the states that where it's not just medically legal, it's recreationally legal. I mean, I think this is applicable. All the science, everything points to the, you know, all the ways in which it helps with a lot of different kinds of diseases.
Do you have anything else that you want to say?
I think that it has been it's helped me out a lot, and I think we need to destigmatize. But I do also want to say that I don't advocate it for anybody under, I don't know, I would say 25. Like, your brain's still forming. But,
Yeah.
okay. All right. Peace out.